Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, a podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Gina and Steph, who are both family nurse practitioners. They currently co-own a telemedicine practice focusing on a variety of services, including hormone replacement therapy, mental health, and weight loss. They are needing assistance with building the brand, increasing patient volume, and balancing full-time jobs with this part-time business. Hey, Gina and Steph, how are you?
Good, thank you.
Good. Okay. You guys have another partner that might potentially come in. So we will, if she comes in, she comes in. If not, it is what it is. So let's go ahead and just get started. So tell us about yourselves. So we'll start with Gina. Tell us, how long you've been a nurse practitioner and what kind of things you've been doing.
Sure. So I'm a family nurse practitioner. I specialize in obesity medicine and also hormones with postmenopausal women. I've been a nurse practitioner for about 15 years, a nurse for 30 years. And this practice that we started, this just evolved over the past year. And we are a PLLC.
Okay. And Steph?
I've been a family nurse practitioner now for 5 years and have a NRC for over 8 years now. I currently work as a family nurse practitioner in community health, where I specialize caring for persons with HIV. So I'm an HIV specialist, and I also have a strong focus on trans care, LGBTQ care, and all of the like.
Okay, so you guys started this telemedicine practice. So Gina, how are things going?
Well, like Stephanie, I do work full-time in primary care as well. I'm fortunate where I was able to cut down my hours and able to still keep benefits working 3 days a week. But in terms of telemedicine, I am doing it 2 full days a week, including evenings. And my struggle really is increasing my patient volume. I have a very small census right now. And I'm trying to increase not just the amount of patients, but the frequency I'm seeing them, just in order to meet their own personal goals. But it's really just increasing my volume.
Okay. And Steph?
So like Gina said, I work full time, and I'm the only partner in the practice who is kind of starting from the crawling stage. So I don't have a patient volume with our private practice because I work full time, and my full time job consumes most of my time. So I do have a 4-day work week, but on that 4-day, on the 1 day that I'm off, I'm doing administrative duties for my other job, and just finding it hard to get kick-started, to make time for my own personal practice. And yeah, and I'm starting from the beginning. So I also am trying to find out how to market myself in my specific niche.
So let me ask you guys. So
I'm kind of confused about what you guys do here exactly. So it sounds like a multidisciplinary telemedicine practice. You guys are doing multiple services that don't necessarily complement each other. So I guess my question for you guys, we'll start with Gina, is why even bother partnering on this? And why not just do your own thing?
Do it individually. We have a long history together. We also have a 501c non-for-profit that we began almost 20 years ago, and we've been doing that for a long time. And we knew that we wanted to work independently. And I think just our familiarity with each other and our comfort working together, we wanted to build something new, a for-profit together.
Yeah. Okay. And Steph, is that kind of your perspective on it too?
Yeah, that's exactly right. Yeah.
Yeah. Yeah. Okay. So I guess I'm thinking about this from just strictly a business standpoint, not a non-for-profit standpoint, not from a
Yeah.
friend standpoint or anything like that. Okay. So typically these multidisciplinary kind of things, especially telemedicine, especially if you're not accepting insurance, could be difficult. Okay. You guys are cash based, I'm assuming?
No, we do accept insurance as well.
You
We're
guys do.
credentialed.
Okay. Okay. You guys accept insurance too. Okay. Anyways, though, but with it being telemedicine, it's going to be difficult. So the reason why is that telemedicine practices are generally going to be reliant on digital marketing for basically getting the signal out there to patients. Patients might be able to find you by just doing a Google search, but Google typically prioritizes local businesses that have an actual physical location locally compared to digital businesses that really don't have a local presence. Okay. So if someone gets on Google and searches for weight loss therapy for, kind of what you're doing, Gina, the chances of them finding you versus just someone, 5 miles down the street, are pretty low. All right. And then the same thing for like transgender care, LGBTQ care, if there's someone else doing it locally, Google's going to prioritize that finding versus your telemedicine practice. And it ultimately depends too on how much content you guys have on your website talking about each service line, because Google doesn't know what you're doing. These search algorithms, they don't know what you're doing unless the content is on the website for them to know, because all they're doing is basically just scanning the web, scanning websites. Little bots are going out there, scanning your website, and they're looking for content. And then they basically use that in an algorithm. So when people search for things, they know that, basically they know to prioritize, these different websites that come up. And so with you guys doing multiple things and your other partner doing psych on top of it, it's just like, how does an algorithm on these search engines, Google, Bing, etc., how do they know what it is that you do, because you do so much? So it's going to be a little bit of an uphill battle here. Does that make sense?
It does. Let me just throw in too, Justin, that we do have in New York City an office space as well. It's a small office space that we sublet, so we do have a presence there as well for people who do want to see us in person.
Okay, but the thing is, though, is still, how do people find you?
Oh, I know. No, that's that's exactly why I'm here talking to you.
Right, like you guys do so much. How the hell, how do they find you still? Like you can't. What does your Google business listing say? Transgender care, weight loss, and psychiatric health clinic. What the hell? I mean, you know what I mean? Like, people are gonna be like, "Okie doke, jack of all trades, master of nothing here." Like, what? It's like when I was doing research on testosterone replacement therapy clinics, and I wanted to just look at some other websites, so I can get kind of a general idea what other websites look like when I was building mine. This was 5-6 years ago. I remember I came across this Chinese doctor in California or something. And like his website was like men's health, testosterone, Suboxone, depression treatment, weight loss. I'm like, okay, there's no way in hell I would see this guy. Right?
Yeah.
So think about think about the perception that you're giving to people, right? So that's why I'm saying, is it best for you guys to collaborate together and do this together? Or would it be more advantageous to have separate businesses, yet you guys have a very, very strong referral system in place? You guys still collaborate. Maybe you guys still bill through like a parent company for the insurance, etc. But you guys have your own kind of separate clinics. Does that make sense?
Okay. Well, I mean, we're under one PLLC as it is. So you mean just in terms of marketing ourselves separately?
You can either market it separately as DBAs, right?
Oh, okay.
Okay, you
Yeah.
can either do that. So like maybe underneath the PLLC, you guys would have separate DBAs, right? So Steph's DBA can be whatever LGBTQ care. Yours would be whatever weight loss clinic. Your partners would be whatever mental health and psych, whatever you guys want to do, right? Separate
Yeah.
websites, separate phone numbers, separate scheduling apps. Like it looks as if they're separate businesses, but when the patients are signing the paperwork, it lists your PLLC. They don't care what the actual legal name is or who the partners are. They don't give two shits about that. All they care about is care, right? Yeah. And so that's what my advice would be for you guys right now, because I feel like it's going to be an uphill battle if you guys are sharing the same website and all that stuff. It's going to make marketing difficult.
Okay.
Yeah. Yeah.
I hear what you're saying. Okay.
Yeah. So that's what I would do if I was you guys.
Okay. So keeping the legal structure as it is, but just separating like the doing business as piece to almost make it look like it is three separate companies, even though we're under the one PLLC.
Exactly. Have separate Google business listings, have separate websites. Like it looks as if from an outside perspective, it's different. So if you go to the Elite NP website, click on all articles. I wrote an article on how to do a DBA legally, like what things you need to be concerned about, what things you should consider. Those things that you need to be considered about is that the patient needs to still know the legal entity. Okay, there needs to be transparency there. And so what you guys would do is, sure, at the top of your website it would be whatever weight loss clinic. Down at the very, very bottom, the footer of the website, it would be just whatever PLLC. And then on all your consent forms and everything, it would list the PLLC.
Okay.
That way it protects you guys.
Yeah. Okay.
Yeah. I mean, that's pretty much all you got to do. And then you guys can still bill through the same PLLC, the NPI, like you got the group NPI. You guys could still do all of that. You guys could share bank accounts if you want, etc. But this is another thing too that complicates partnerships like this, especially when there's 3 people involved, is how do you truly know who's making what? So like Gina, for example, if you're making 80% of the income of the entire practice, how does that look from a tax perspective? How does that look from a equity standpoint? You're bringing in 80% of the income, yet you only own 33% of this business. What does that look like?
Yeah. Well, we itemize everything in the universe. It's very itemized income, like who's billing what money is coming in, and same with expenses. And we have an account. We have a CPA who manages all of this for us.
How do distributions look like though? If you're bringing,
they're all diverse. No, it's not across the board. That's the thing.
Okay, gotcha.
Yeah.
So I mean, if you got a bookkeeper, CPA that's able to really, fairly separate everything out, then as long as each partner is getting their fair share of the work they put into it, then so be it.
Yeah.
Yeah. Okay. From a tax perspective, you're just going to be taxed on the distributions. I mean, that's really all that matters. Yeah. Okay. So, from a marketing standpoint, guys, increasing your patient volume, this is what I would advise that you do.
Okay. Except doing business as, and Justin, Tahisha did jump in. She's on the call now, by the way.
How are you?
I'm well, thank you.
Gina and Steph can probably fill you in. But basically what I was saying is that you guys need to separate out your business from a DBA standpoint. You guys need to have separate websites and stuff, because it's gonna be very difficult building a multidisciplinary practice up like this. So, but yeah, do you want to introduce yourself? Tell us about, how long you've been a psych NP for and what kind of things you've been doing?
Sure. So I have been practicing as a psychiatric nurse practitioner for over 10 years. I have been an advanced practitioner in the field of community and public health for over 20 years. So currently, I have been seeing close to 75 to 100 clients under the umbrella of LOC since the beginning of last year, 2022. And I use various platforms to recruit clients, one being Alma, the other one being Psychological Today. I also have other types of marketing strategies that have been extremely helpful in creating the influx of clients. Most of my clients are insurance billed, and a few scattered with private pay, but not so much. A lot of the clients that I'm currently seeing is for medication management. I do have some therapy clients as well. My practice basically takes up close to maybe 40 hours a week. So I guess full time, but condensed into 3.5 days. And I also do some other types of work within the field of mental health during my other available time frames, but they all somewhat a little bit overlap with the different resources that I do provide. And that's basically it for now on that end with the mental health piece.
Gotcha. Okay. So it sounds like you're pretty busy.
Somewhat, yes. And
Yeah.
it is growing, yes.
Yeah. Okay. So rank here for me, guys. So, okay, first, Keisha, it sounds like you're seeing a lot of people here
Yes, about maybe 50 people a week.
through this business.
Yes.
Gina, how much are you seeing?
Ooh, probably 10 to 15.
10. Okay. And then Steph she just got started, so she's not really seeing anyone. Okay.
Yes.
So is there an opportunity here for referral?
Yes,
Yeah.
definitely. It's interesting because I do have clients that have inquired to me about different referral resources, and I believe we have been able to kind of share a couple of clients who were interested in weight loss management between Gina and myself. I also have clients who have inquired about other levels of primary care services in addition to that. So there is opportunity for that wraparound approach. It's just basically preparing for that.
Right, right. Yeah, I think that for you guys to have a very, very fruitful partnership here in a successful business, I really feel like that you guys should be prioritizing referring to each other, I mean, Steph, a lot of people in the LGBTQ community, transgender community and stuff like that could probably use some mental health and vice versa, right? And people with weight loss. Yeah, people who are obese, maybe struggling with depression, anxiety, you could refer them to, within the practice itself. So you guys really should be trying to maximize the lifetime value of each patient. Like this really should be a priority for you guys, because if it's not, then what the hell's even the point of this partnership?
Okay. Yeah.
There's no point. Do your own thing. Like, why would you even be bothering?
Mm-hmm.
Yeah. So I would be prioritizing that. That's a self-referral thing. That's almost that kind of goes in within your marketing strategy itself. And I've said it before on other podcasts. It is a hell of a lot cheaper to maximize the value of an established customer versus getting a new one. So it's a lot cheaper. Okay. It's basically free. Getting a new customer can cost money, especially if you're spending money marketing. And so, maximize the value of each patient. I mean, I wouldn't refer to each other if it's not necessary, but I think that if you do some deeper digging through the patient's history and their desires, their needs, etc., then I feel like there's an opportunity here. A mental health patient who's 50 pounds overweight, there's no question that losing weight is going to help them feel better mentally, right?
Yeah.
Yeah, and someone who's overweight, who's depressed or whatever, yeah, sure, they're going to be losing weight, but maybe they could use a little bit of some therapy or whatever. So I'd be maximizing this. You guys really need to maximize the self-referrals. I think that would generate a lot of revenue and more business within the partnership itself. So just keep that in mind.
Yeah, absolutely. Thank you.
So increasing patient volume here. So Takesha, sounds like you probably don't really have much of an issue with this. You're just organically probably going to grow from word of mouth and insurance referrals, et cetera. Gina and Steph, on the other hand, you guys need to get some patients in the door. So, so the first step is, what I always talk about is have the foundation first of your marketing strategy. And by that, I mean your Google business listing and your website. Okay. So you guys really need to prioritize, in the next couple of weeks of getting a new website built for each one of you, figuring out the DBA name, and then creating a different Google business listing. Okay.
Mm-hmm.
That's what you guys need to be doing now before doing anything else.
Okay.
Yeah. And make sure that the patients that you guys have already are giving you reviews for the new Google business listing. So Gina, for example, if you have, if you're seeing 10 or 15 clients a week, how many patients do you have? Established patients? Estimated?
Not a lot. I have about probably 25 established because I do a lot of weekly visits.
Okay,
Mm-hmm.
25 established patients. Then when you create your Google business listing for whatever Gina's weight loss clinic, you need to make sure that they are posting reviews on there. Like, ask them, can you please post your review?
I will say that because we have Tebra, and that's our software, and my patients have been, and it's being reflected in Google. I'm definitely getting a lot of really good feedback that way.
But that's to your guys' PLLC.
Oh, I see what you're saying. Yes. Okay.
You're creating a completely new Google business listing.
Okay.
Right. So you need to make sure they go on there and give you as many 5-star reviews as possible. Because people now in your area, when they search weight loss clinic, Gina's weight loss clinic now comes up, and Gina's weight loss clinic has 25 5-star reviews. Like that is super important. Same thing with you, Takesha. Okay, when you create your DBA for whatever mental health clinic, get all your patients to start putting 5-star reviews on there.
All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
Steph, you don't really have a whole lot of patients right now, so it's just going to be one of those things that will slowly happen over time. Okay.
Right.
Yeah. So you guys need to do that. Like that right there is free and extremely effective. And then the website, obviously, the website needs to reflect what services that you have,
Okay.
And even in the navigation bar, you could put referral opportunities or partnership. You could have like a little tab there, partnership. I have partnered with your 2 other partners and discuss, what services they provide. And, you could just write a paragraph or 2 saying that we have a strong referral network for everything ranging from weight loss, mental health, transgender care, et cetera, et cetera, et cetera. Then just leave it at that.
Yeah. Sounds good.
Yeah. Yeah. So I would start there, guys. I wouldn't spend a whole lot of money on Facebook ads and Google business ads or Google search ads. I wouldn't spend a lot of money right there right now. I would just start here.
Okay.
Yeah. I mean, you guys have jobs, you guys have income coming in. So it's not like it's critically important that you get to $10,000 a month right now because you need to pay bills, right?
Yeah. Well, that's true. Myself and stuff. Yes.
Yeah. So we covered that. Any other questions one at a time in terms of marketing goes?
Not for me. You've pretty much covered it.
Okay. Steph, any questions?
Yeah, I don't think so. I think I just have to, with the psychiatric services, like Takesha was saying, there's so many platforms for folks working in psych to seek clientele from. And so that's it. It's just like thinking of resources where I can and I think Regina the same, but yeah,
Mhm.
I think that's the only deficit that we have.
Okay. And then, Keisha, do you have any other points on marketing?
No, I think that for the most part, I do feel that mental health marketing tools are a little more accessible in this field compared to other types of areas. So I haven't had that type of issue. But I do, I guess, encourage that we maybe look into other routes, maybe moving forward.
Yeah, yeah. You know, mental health is almost like a cheat. In terms of marketing goes. Like there's such a need for it. Like any nurse practitioner listening to this, if you want a fairly easy business to get started, become a psych NP and open up a psych practice, like it usually gets busy fairly quickly on its own. It doesn't really require a whole lot of money marketing and stuff, you know? So, but yeah, the other services like weight loss and hormone replacement therapy, et cetera, that tends to be a little bit more difficult. Okay, now Gina and Steph, I know that before the call, you guys mentioned that you guys want to talk about, I guess, balancing full-time and full-time work with part-time business. So, Gina, we'll start with you. Tell me a little bit about the struggle with that.
Okay, well, I do work full-time hours in a 3-day work period now. I was fortunate I was able to change that from a 5-day work week in order to do more for this company. But I work in primary care and I do true family. I see children till geriatrics. I do GYN. I do everything. And it's a lot. When I'm there, it's a lot of patients. In primary care, I'm seeing 35 people a day. And it's a lot in primary care because there's so much involved with me doing prior approvals. Charting is the worst part. And then coming home and having to still chart for my full-time job, and then trying to build my work in my telemedicine practice. So it's just a matter of, figuring out a way to balance my schedule.
Yeah, it's difficult. I mean, I've been there before too.
Yeah.
I was working full time while I had a part-time business, and I mean, I get it. I guess the first thing you need to do is determine how do you save time with the job that you're at, right? I mean, if you're bringing home charts and stuff, that's never good. Even if you don't even have a part-time business, like that's just never good. I have never in my entire life as an MP brought home charts or work. I
I don't
don't.
bring them home, but they're there waiting for me at work. You know what I mean?
That's
I have a
right.
lot of open notes. Put it that
Right.
way.
Yeah.
Yep. Same.
Yeah. Yeah. What I always tell new grad NPs or established NPs that are having problems, I finish the chart before you move to the next patient. I don't know how the hell you could remember what you talked about with the patient. I don't know how you could chart later. That doesn't, I don't see how that's even possible. So I guess if you're spending way too much time charting, I guess you need to look back and think to yourself, is what you're charting truly relevant and important? You
Yeah.
know, in my opinion, less is more. I've talked to a lot of lawyers and a lot of lawyers' opinion. Now, remember, this is one thing about lawyers. It's all opinions. Okay.
Yeah.
Like the law, a lot of the time is interpretation and opinion. And a lot of lawyers' opinion and malpractice attorneys and people who defend providers, a lot of times they will say less is more. The less that you have documented, then the less that the other attorney that's suing you can use against you. Okay.
Mhm.
In nursing school, they tell you, if you didn't chart it, it didn't happen. Or if you charted, it happened. Right. Yeah. Okay. That's fine and dandy. But sometimes it's better just to not chart a bunch of stuff. Like every single thing that you chart can then be used against you in a court of law. Okay. If it's not charted, then technically it didn't happen and it's open for interpretation. That's kind of what you would rather have versus every single thing charted. Okay. That's my opinion. That's the opinion of some other lawyers. Some other lawyers will tell you to chart every single thing that you've ever done, etc. At the end of the day, every case is going to be different. If you're sued, it's going to be up. It's up in the air. It's ultimately going to be a decision of a jury. So it doesn't really matter. So anyways, though, I chart less is more. I use macros. I use templates. I only chart what is relevant to that complaint of the day or what we were talking about that day. I do not document a bunch of other stuff. If someone came in for hypertension management, I document something about hypertension and I don't document about anything else. Weight loss, and that is it. Depression, that is it. You know what I mean? I don't talk about anything else. Focus note. I don't, like, what are you doing right now?
No, it's well, yeah, no, it's not. I shouldn't even. Okay, so I do when I say charts are open, I use templates for sure. I fill in the assessment. I do my chief complaint and my HPI pretty quickly. It's just like the finishing up, just making it look neat, like with the education piece and stuff like that. So before I lock it and code it, before I code and lock it.
Whoever looks at that.
I know.
Does anybody? I can tell
I
you
don't
right
know.
now, nobody looks at that shit. So why even bother?
I know it's true.
My notes have spelling errors, grammatical errors. I don't capitalize. I don't give a shit because no one's looking at it.
Yeah, no,
Like,
absolutely.
who's looking at this stuff? No one is. The only time that's ever going to be looked at is if you're sued or if there's an audit. Otherwise, no one's ever going to look at it. I just off the top of my head, this is just a total guess, but I bet 98% of everything that we ever chart, no one ever looks at it ever again. So why bother? It's a waste of time.
Yeah, I agree. Yeah, absolutely.
Yeah. So I don't know. That's just
I will gladly take that approach to wrap these charts up quicker.
yeah. Take that approach. Screw it.
Because I have a real hard time just clicking close. I'm like, oh, then she did say this, and
I know.
to a new
Overthink.
apartment, and
Yeah, we're overthinkers.
Overthinkers. Just keep it simple. A simple, focused note. Okay. Yeah. You look. Yeah. I look at a lot of doctors' notes and stuff. They're the most simple, focused note you've ever seen. Like sometimes you're just like, really, that's all you're going to chart? Well, you know what? It works for them. It works for you too.
Yeah.
Yeah. So that's my opinion about it. So I think if you did that, it would save you a hell of a lot of time.
No, I'm for it. I'm absolutely for it. Not a problem. I can keep it very focused.
Yeah. Do that. And then in terms of juggling the job and the business, what I usually do, or what I did when I was working, I don't work anymore, but what I was doing was the day that I saw patients, I usually saw patients on Fridays. Friday was my business day. That's the day I spent on the business. That's the day I spent on bookkeeping. That's the day I spent on doing marketing stuff. That's the day I spent seeing patients, charting, etc. That was my business day. The rest of the days out of the week, I didn't really have to do a whole lot with the business. That way I could go to my job and do whatever. So you got you had to set boundaries, but and it's a personal boundary, really, right? You just say I'm only going to work on the business this day or during this time. Otherwise, I'm not going to. Because if you're doing it here and there while working, and it's going to drive you crazy.
No, it's true. It is. It already is.
Yeah, and you only have 25 patients. Imagine what it's going to be like when you have 500.
Exactly. Exactly.
Yeah. So Steph, I know you're kind of just still in the infancy stage. So is this much of a problem for you yet?
Well, yeah, it's like finding the time to dedicate towards my business, because this is a goal of mine. And yeah, I can't even get from crawling to standing because I do have the 4-day work week, but I can't even, all of the things that Gina said, all of that applies, and I'm really overwhelmed at my job now. So
that one day that you have, let's just say that work week's 5 days out of the week. I mean, you gotta have a weekend, right? So you work 4 days at your job, and then the one day is spent on the business. So what are you having problems with in that one day? Like, why can't you, I guess, focus on the business and just say, this is the day I'm going to spend working on my business. I'm not going to do anything else.
Well, two things are, I'm finishing up the last semester of my doctorate, and the second is half of my off day technically is my admin day for work. So that consumes. So I'm assuming that after December, part of that would free up, and then it's just getting my work to stay at work during the 4 days and not on that 5th day.
Right. Okay, well, I mean, if you're finishing up your DNP, then yeah, it's I mean, what do you do here? You're working 4 days a week, you're finishing up a DNP, and you're starting a business. Like, you're not. That's a damn near impossible feat for anybody. You know,
Mm.
so I don't think I'd be too hard on yourself right now about it. So you finish up this semester.
Yes.
Okay, perfect. So I mean, if you're finishing up this semester, then basically, in a few months from now, you're gonna. I mean, how much time is that going to give you?
Well, yes. If I can not have admin for my job on the one day, then I'll have my day back. Yeah.
Right, right, and you're not having to, and you're also not having to worry about your DMP too, right?
Right. Right.
Right. So, like, I think that maybe in 2 months from now, I have a feeling that it's probably going to just be a hell of a lot easier for you because now the DMP is out of the way, and you don't have to worry about that anymore. You can spend that, you can use that energy and time to put on, focus on your business instead.
Right.
Yeah. So I think it's mostly just a waiting game for you at this point. Um,
Right.
yeah. But like I was telling Gina, just try to leave work at work. You shouldn't be bringing home any of that stuff. If you are, you have to really sit back and you have to tally up, where are the time sinks basically. Like that's with anything in life. If you find yourself having a hard time with time management, the best thing you can do is stand back and write down, um, where am I spending most of my time? What am I spending most of my time doing? And then look really hard at that particular task and say, okay, how can I streamline that more? Like some people are amazed after they like tally up what they do during a day. And they're like, wow, I really waste a lot of my time, doing this thing. And I really shouldn't be wasting my time on that. You know what I mean? And you might not even be
Yeah.
aware of it until you really just sit there and write it down.
Right.
Yeah. I mean, how much of your day is spent on stupid nonsense? Like, you know, let's just say, for example, maybe like being on your phone, looking up crap on social media
Mm-hmm.
or texting or whatever. Like, how much of your time is wasted on that, if any? This is just an example, you know. Um, or, going through every single review system and plus and minuses and clicking buttons and stuff like, is that
Yeah.
really necessary?
Right.
Yeah. So I think you just what I would do if I was you is over maybe the next couple of weeks, why don't you sit down and just like with a notebook and just kind of just diary journal like your day and see kind of where you're spending time.
That would be helpful because I have no control of my time, and then before you know it, the day's over, and I'm like, what? Well, what happened?
Right. What did
I
I
don't
get
even
done? Right.
know. Yeah.
Right. What did I accomplish today? I feel like I didn't accomplish anything. Yeah. Well, you spent your time doing something, So,
Right.
so I think if you journal it and you write it down, you can step away and be like, wow, I waste a lot of my time doing that and I should stop doing that.
Yeah.
Yeah.
I'll give
So,
it a try.
okay. And then, Takesha, it sounds like you might not have much of a problem with this.
Um, it's interesting. I have two children, so I have to practice doing my notes during conversations with clients, and it's been something that just somewhat has helped me through most of my nursing career. I have to kind of just zone in, and most of the time, clients are okay when you are conversing with them and typing at the same time. And I do make sure that they understand that and it's just been very helpful for me. So, I've tried to make that a part of my practice once in a blue moon. If I have a long day, I may need maybe a chart or two to complete another time or the next day. But usually I try to complete it on the spot.
Gotcha. Good. Okay. So you're not really having a whole time juggling, the job that you're doing plus the business. It sounds like you have a pretty good system here.
I try. Like right now, I'm going to soon have to excuse myself because I do have something else that's on my schedule. But it's really about time management for me and utilizing all resources just to kind of balance the checks and balances. It's not easy. It really isn't. But I have no other choice, especially when two little ones and my family are definitely the priority at the end of the day.
Sure. No, I get that. Okay. Well, if you have to run, it was a pleasure meeting you, and maybe Gina
Yes, and
Steph
thank
will
you
be able to
so
tell you.
much.
All right, you're welcome. Take care.
Yes, you too.
All right. So Gina and Steph, any other questions or issues that you feel like maybe I haven't helped you out with? I know this has been kind of a unorganized podcast, but any other questions?
No, it's fine. I think that, like, Steph and I, we are in a very different, we're in the same position and very different from Takesha. It's from the beginning when we started this, she had such a quick influx of patients and referrals and so many other platforms that she was able to utilize in order to obtain patients. And it's just, there's a lot more flexibility for psych mental health than there is for family nurse practitioners in telemedicine. And we're lucky we're in a state where we don't have to collaborate, so we can work independently. And even so, with telemedicine, it's pretty hard as a nurse practitioner.
Yeah.
As family nurse practitioner. It
is. Like I told Takesha, being a psych NP and starting a psych practice, mental health practice, it's kind of a cheat. Like you get so many patients without even having to really try. Yeah. And so these other services can be a little bit more difficult. Yeah. So I seriously think that your guys' biggest issue is just what I talked about earlier about not having a really truly focused outward perception. I think that's probably what's really holding you guys back.
Yeah, separating it a little bit more. Yeah.
For sure. So I would spend a couple $1,000, anywhere between 1,000 to 2,000 if you can, get just a decent website up and get that Google business listing up, and then kind of just see what happens, and then really focus in on the self-referral stuff. Like, I know that you guys have patients that could benefit from each other. It's just getting these patients right now, right?
Mm-hmm. Absolutely.
Yeah. So, any other questions?
No, not on my end.
No.
I
think yeah.
Cool. Awesome. Well, it's a pleasure speaking with you guys. Hopefully this helped out. If you guys want to do a follow-up, maybe in a couple months after you guys get the DBA set up and the website and everything, let me know. You might run into an issue. Maybe you're not getting enough patients, and we can maybe talk about some more specific marketing stuff. So feel free to reach out to me then.
Thank you so much, Justin, for the time.
Okay.
Thanks
you guys
for
are
your time.
you guys are welcome. You guys take care.
You too. Take care.
You.
All right. Bye. All right, I hope everyone enjoyed the episode with those 3 nurse practitioners. Partnerships typically don't work out very well. In their case, it sounds like they've known each other for 20 years, and it sounds like there's a real strong trust element there. So, in their case, I hope it works for them. I really do. But the issue comes down to the alignment of complementary services. So if you're going to go into a partnership, or if you plan on doing multiple services that don't necessarily complement each other, I need you to be thinking to yourself here, how does this look like to the public, right? What's the perception of people seeing your clinic, landing on your website, etc., right? That's critically important, guys. You can't be a jack of all trades and a master of nothing. It gives the wrong perception to people. In their case, doing transgender care, weight loss, and mental health, and kind of a little bit of everything in between. It's, what do you name that? What do you name that practice? Like, there really isn't a name, right? That doesn't really complement each other all that well. So I think that in their case, doing DBAs for each service would probably be the better thing. And you can do stuff similar if it's, a solo practice of yours, or if you want to grow into another practice area, you can do the exact same thing. You could have a website for a completely separate service line. Let's say you're doing weight loss and you want to do hormone replacement therapy as well. You could set up a completely different DBA, a completely different business, but operate out of the same legal entity for the hormone replacement therapy. Okay, you can do that. Go to the Elite NP website, go to all articles and search DBA. I talk about that in depth in that article. All right, hope everyone enjoyed this episode. Talk to you guys later. Thanks, bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcast. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.